Welcome, and this is one of our ongoing webinars in the Housing First Europe Hub. We started doing these webinars at the beginning, or I guess at the beginning of the summer, sort of late in the spring. And for us, it's a great way to bring you information, bring people together in this time where we're not able to meet each other, which is difficult for all of us, and everybody who's participating today, I'm sure, feels the same. So we're hoping this is the next best thing, and we wanted today to talk about Housing First for Youth, and in particular, the very successful pilot project that the Housing First Europe Hub has been supporting with the Rock Trust in Scotland. So that will be the focus, and then we've asked for two responses to this pilot project, but with input from their own experience piloting Housing First projects. Lisa will speak to us from Ireland, and Melanie will speak to us from Canada with a Canadian example. But I will do a little bit of introduction of our speakers, starting with Kate, and then I'll ask Kate to share her screen and start with us. But Kate Poulsen is the CEO of the Rock Trust, and she's been working in the homeless sector for almost 25 years. And for the last 10 years, she's been the chief executive of the Rock Trust, which is Scotland's youth homelessness charity. And the Rock Trust has always aimed to end youth homelessness by delivering services directly and by influencing policy, strategy, and practice. And recently, they have piloted the Housing First for Youth model, and has made also great strides in making that a model that other organizations are looking to adopt as well. So without further ado, I'm going to hand over to Kate and ask her to share her screen. Yeah, thanks for being here, Kate.
Thank you. Okay, see if the first bit works. I hope people have had a chance to look at the evaluation report itself. It gives quite a lot of information, so I thought it was important to start off today by giving some information which is not included in the report, to talk about the kind of bigger picture, so how it's affected us as a country, and the models that we're now using nationally. So I'm going to start off talking a little bit about the national context. So when we first started our Housing First for Youth project, there were already rights to housing in Scotland. So everyone has a right to a home, and whilst there were some tests of homelessness and a clear homelessness pathway, it was a bit different to what it is now. So when we started, there were shelters. Now, essentially in Scotland, a shelter would normally mean a church floor. So you might have between 40 and 60 people sleeping on a church floor on any given night of the week. And this is a kind of emergency accommodation, whether you're entitled to housing or not. We then had, on the pathway, we had emergency accommodation, which included bed and breakfasts and direct access hotels, which were very short stay. We have temporary accommodation hostels, so they might be 20 plus beds with 24-hour staff, which are up to maybe 6 months. And then we have supported accommodation, so longer term hostels, individual temporary tenancies, up to 2 years. But some local authorities have no provision for young people specifically. So young people from the age of 16 may well be expected to enter that system with adults, so a very general homeless system. So there were some organisations like ours providing youth-specific accommodation or services, but not necessarily in every area. Provision was quite patchy across the country. Now, that's changed. So since we started the project back in 2017, a lot has changed. And to go back a little bit further, in 2016, we launched our Away Home Scotland, so the National Coalition for Youth Homelessness, obviously following the Canadian model, and Melanie, who's on today, also helped us make that happen. We launched that back in 2016, and following that then started planning for the Housing First for Youth project. And our project was to be delivered in one local authority area, and more specifically for young people who'd been in local authority care. So young people who the state was a parent of. And for us, young people coming from care were quite often the young people who got stuck in the system. So we thought it was important actually to take care of that group. Just after we launched the project, there was a group formed with the government and third sector bodies called the Homeless and Rough Sleeping Action Group. And this group had a very clear remit to work out how they would end homelessness. So there was very immediate needs, like what we're going to do this winter, and then the longer term needs as well. And the work that they produced became the Ending Homelessness Together action plan. And they worked with the whole sector and with people with lived experience to put that plan together. And that plan was really addressed at not just ending homelessness in the longer term, but also to implement a strategy of rapid rehousing, to transform temporary accommodation, but also to work out what further steps needed to be taken nationally. So as part of that, the National Housing First Pathfinder project was launched across 6 local authority areas, but 5 projects. So each area was chosen and third sector providers came together in groups to deliver Housing First for adults. We were able to extend the Housing First for Youth project to be part of that. So we moved into another local authority with the project and actually began delivering in Edinburgh for all homeless young people, including care leavers. As that started, each local authority was working on a rapid rehousing transition plan. So essentially a plan stating how they would move from their current model, so the shelters and hostels and temporary accommodation model, towards rapidly rehousing people in more permanent, stable and mainstream accommodation. The government also began developing prevention pathways, so pathways that enabled us to prevent homelessness for the most vulnerable groups, including young people, care leavers, those experiencing domestic abuse and veterans, so those who had been in services. The third sector worked together then to create the Everyone Home Collective, which had a group of route maps which we created, one of which was to transform the shelters so that no longer would they be provided on church floors, but they would move to dormitory style or even hotel style accommodation that was very short term and more akin to a rapid rehousing unit, so really short term. We also worked on how to access private rented sector, and we still are, anti-destitution strategies. So all of this work was all ongoing at the same time. Of course, then the pandemic, the global pandemic hit. The government group met again and worked out how they would address coronavirus and the impact of it by taking advantage of some of the processes they'd put in place to keep people off the streets. So now, Housing First for Youth has been mainstreamed in the evaluation pilot area. It's been mainstreamed already this year. We have started and we're about to mainstream in a further area, and we're about to start delivery in yet another one. So we will be in 3 local authority areas providing Housing First for Youth. But actually, because we have the rapid rehousing transition plans, we now have quite a large group of people who are all starting Housing First within their own areas, which is really exciting. So it really has become a national programme. In the Rock Trust context, we've been providing youth-specific housing support to 16 to 25-year-olds for nearly 30 years now. A range of models, so Night Stop, the community hosting model, shared supported accommodation, single supported accommodation, visiting support and outreach, and a rent deposit scheme. All of them trying to create space for young people to learn how to live independently or more independently. But why did we choose to deliver Housing First? Seems a silly question to ask, but actually we do get asked it quite often. Young people couldn't always have all of their needs met, and even at our housing services. So for some young people who experienced homelessness, who perhaps had other issues, our shared housing was not accessible to them. Our Night Stop services were not accessible to them. And even when we could enable them to access our single supported accommodation, their needs just couldn't be met there. So a visit a week or 2 visits a week was never going to be enough for them, and appointments were not going to work. So we were working with lots of young people in our drop-in centre who might not be able to access accommodation because of their past, their history of behaviours, or actually because of their experience. They didn't want to access temporary or shared accommodation. So we completely believed that Housing First, as all of the evidence was being created and being circulated across the world, we believed that this could really work for some of those young people. Now, I've written in here that we were willing to self-fund. I don't mean self-fund that the Rock Trust funded it all. We didn't. We worked with our corporate supporters, also our housing partner in Ammonds Housing Association and the Housing First Hub to create a funding model that worked. But actually, what we didn't do was wait for it to be mainstreamed. We didn't wait for it to be commissioned service from the local authority. We were ready to test it, and we knew that some people were reluctant to see it as a solution. So actually, we wanted to test it so that we could say whether or not it would work for this group of young people. So actually creating the service ourselves had lots of benefits because it meant that we could be as flexible as we wanted to. We weren't reliant on the commissioning model or on other people to make that happen. So that was actually quite a great way of starting to pilot this project. But we're also very aware that we could lose other services. And again, it's one of the questions we get asked and one of the worries that we know our partners have. So we launched Housing First in an area where we also provide supported accommodation. So that is short term, 6 months to 2 years, flats, and they were community-based flats, and we do visiting support and outreach to the young people in those flats. And we knew that if Housing First worked, that potentially those flats would no and everything would move to Housing First. And we know that some of our partners who have historically delivered supported accommodation felt like Housing First was a huge risk to their services. We, I guess, took the idea that if Housing First worked for young people and worked better than supported accommodation, then that's what we should be providing. So we knew that that was a potential, but we thought we need to try it and see if it works and if it can work better than anything else. And particularly for the specific group of young people who had multiple needs. I guess then the initial success of the project and the experience of young people going through the programme encouraged the growth and mainstreaming of Housing First for youth in Scotland. So, to the evaluation findings. I've split this into two because there are the evaluation findings and then there's actually what it means for our bigger picture in our national context and for the Rock Trust in particular. So the evaluation was undertaken independently and we thought that was really important because we could see success, of course, and we can report on success, but actually having someone come in and examine whether you have followed the model as you had set out to at the start and to speak to the young people, the staff and the partners all involved actually was really important to us. And the first thing is that all of the young people achieved a positive change to their lives as a result of the project. And it had, across many of the findings, is mixed numbers. So 12 young people were involved in the project. However, some of the survey results are based on 8 young people because it was a slow starting position, so not all young people were in for the full time of the project. And it's worthwhile saying that in terms of our Housing First model, we followed the model that was written by the Canadian team, so the Housing First for Youth model rather than Housing First Junior, which is what we always say, it's not the adult model, young people going through the adult model, it's slightly different for young people. But it's also worthwhile saying that we met some of the adult criteria. So our housing, in terms of Housing First, and what it means in Scotland, is that the housing is individual, community-based, mainstream, social or private houses. And in our case, it was social housing. Our partner was a housing association, so a social landlord. But we didn't have a cluster model. We didn't have 24-hour staff on site. In fact, no 2 houses were on the same street. So and to us, that was quite important that they were community-based, forever homes, or had the potential to be, even though we acknowledged that most young people would move. So it's important to set that out. Although 12 young people accessed the project over the period of the evaluation is based mainly on 8 of the young people. In terms of the tenancies, all of the young people engaged with the project, and all bar one of them maintained their tenancy. But what was really interesting is to speak to the young people about their homes, and it all made them feel proud the home that they'd made and they had maintained. They had a real sense of pride in. What's more is the relationships that they formed. Now, young people all reported that the stickability, the flexibility, the trust built with their worker was really, really important. And some of the young people improved the relationships out with the relationship they had with their worker. And for some of these young people, in fact, most of these young people had experienced significant trauma. Majority of them had also experienced abuse at some point in their lives. So it's quite important to say that this was not a group who easily built relationships. So that took a lot of time, but also was one of the things they felt was most important. In terms of health and well-being, there was some great outcomes there as well. Many of the young people, in fact, over half had reported on presentation that they had mental health problems. But actually it wasn't just that their mental health generally improved, it was that their satisfaction with life improved. And like in the adult services and all the evidence we have coming from New York and the traditional housing first services, drug and alcohol use and its impact on their lives, it stabilised, if not reduced. And a third of them started looking after themselves more, so they improved their diet and their exercise. This group were one of the furthest groups we felt, were one of the groups furthest from employment, education and training. And we expected that at least for the first couple of years of support, that they would be stabilising their lives and their homes, and that would take some time. But actually during the project, 3 of them entered education and training, but many more of them had chosen to undertake new activities, things that they might have found scary or maybe they hadn't even thought about. So the findings from the evaluation in terms of the young people were really interesting. However, for us, some of the highlights were that we were able to successfully support young people to achieve positive outcomes where other methods, and sometimes multiple methods, had failed for them. And we believe this is because there were no preconditions. So young people didn't have a curfew, and therefore there was one fewer way or one less way for them to fail. There was no house rules. There was no forced engagement. So they entirely made their own choices about how they lived, how they engaged in support, and how they managed their home. And that was really important to them, actually, in terms of their other experience. Young people's experience of the programme was also much more positive than any method. So it wasn't just that actually it was more successful in getting outcomes. And we all know that where that's the case, there's also the financial savings for any area that the project happens in. But actually young people's experience of the programme was more positive as well. The security and stability for young people who'd experienced a lot of instability in their lives was really important. And a lot of that was based on their key relationships and the acceptance they felt within them. But also, again, the fact that their engagement and their ability to undertake any activities was all based on what they decided they wanted to do and what their choices were. We think it's really important that young people actually learned how to look after themselves and their home. And in doing that, they gained a huge sense of self-confidence, and their belief and self-belief increased. They were living in their choice of home with their choice of decor and their furniture, which they had chosen, shopped for and helped build or decorate themselves. So it provided a real sense of ownership and pride and encouraged them to maintain it, actually. So it had actually much better looked after than any of our supported accommodation where there is staff available all the time. And one of the things we've always said about the young people we worked with is quite often young people are so busy wondering where the next meal, the next bed, the next decision will have to be made, whatever that looks like, they don't really have time to think about the future. Young people in this project began developing their aspirations for themselves and their future, which I think is really exciting. They started making plans for what that might look like. And it just proves that the stable base in terms of their home and their relationships provided a secure base for them to start thinking about those things rather than waiting on the next change to happen and feeling that insecurity. Last but not least, I think our learning and the things that I think the evaluation shows, and for us is definitely what we're taking from it, is that Housing First for Youth is different to supported accommodation and how it's delivered and experienced. And we do think that a lot of people think that if someone has a house in a community, and if they're doing visiting support to it rather than it being staffed on site or any of these other things, that that's just like Housing First. And actually, as an organisation providing both supported accommodation and Housing First, how it's delivered is different, the way the staff work is different, and how it's experienced is different, partly because there is a sense of security, partly because the language you use around the rules and how things work is different. Young people certainly feel differently in the way they engage with it. I think it's important to recognise that it's really not the same as supported accommodation. Fidelity to the model is definitely best, and we've seen lots of other projects that haven't, and we've sometimes questioned ourselves on how we've stuck to that. But understanding the model and sharing that with young people definitely gives them a sense of stability too. So I think it's really important that you stick with it. For us, our staff having knowledge of youth development and youth work skills has been really important to how the support's been delivered and recognising developmental milestones and the stage that a young person's at. And this might be quite controversial when we're talking about Housing First. However, the relationship building part is almost as important as the house itself. In terms of a stable base, it's not just a physical base that young people need, it's a safe relationship where they can make mistakes and know that that won't result in eviction, where they can live in a messy house if they want to, where the rules are slightly different, where there is acceptance for the way they live. And that definitely changes the way they see themselves and their future. And perhaps one of the biggest ones for us was that the partnership between the housing provider and support provider is a really vital relationship and can have a much wider impact, not just on the project, the future of Housing First, the test or the pilot of it, but actually in the longer term mainstreaming of it. Having housing providers on board and everyone understanding the process has been really important, and helped us as well in terms of engaging other services to support our young people. So yes, that is, I think, everything that I wanted to say. I'm happy to take any questions.
Thank you. I thought it was particularly, I've followed the project very closely, obviously, but I think I'm really very interested, and I'll save my questions for the end, but the relationship that you talked about with a housing partner, I think that's really interesting and valuable, and I think there's a lot of really good lessons that we can all learn from that, and I think there's lots of organizations who are very much wondering, how did you do it, and how do you build that relationship and reach out to housing providers? I think that I'd never heard this term stickability before, but I think it's a really interesting one, and I think that's one that comes through in Housing First for Youth, this whole idea of how, having somebody, a team that you can count on no matter what is really crucial to the success. So I think what we'll do, I'm just going to see, there's just a question about the presentations, but that we will, of course, make the PowerPoints available as long as the speakers are happy with that. We'll post them on our website. And so what I think would be great is if Kate, if that's okay with you, if we move on to the other presentations and have a general discussion afterwards.
Sure, it's worth saying I'll share my presentation also with the links. I talked about lots of documents and things in there, so I'll link those as well.
That's great, yeah, and we can even do that maybe on our website as well. So maybe they're not necessarily just in the document. And we've also on the Hub website you'll find the evaluation as well. So for people who'd like to read the whole report, and it's not so long, and it's definitely worth reading. So thank you very much. Okay, now I'm double checking my notes. I think it's Lisa next. Yes. Yes.
Yeah.
So Lisa is a project leader with Focus Ireland, and she manages a variety of services for people who are experiencing homelessness or at risk of homelessness in Southeast Ireland. She works in youth services, education services, prevention services, Housing First, and Housing First for Youth. Lisa and Lisa's organization, all of the organizations involved in the webinar today are founding partners of the Housing First First Europe Hub. And so this is exciting for us to be able to really talk about Housing First, but also in the context, Housing First for Youth, but also in the context of the Housing First Europe Hub, where the youth piece has been one of the more sort of dynamic pieces. So we're really excited about being able to showcase that today. So I will hand over without further ado to Lisa and ask her to share our screen and talk to us.
So I don't have a screen to share because it's just me. Yes. And so just thank you very much for inviting me to give the Irish perspective on the evaluation report from Scotland. It's been a really interesting journey, and I know that I've been working alongside Rock Trust from the very, very beginning when we first looked at Housing First for Youth in Budapest all those years ago to where we are now seems like such a huge journey. But what's really fantastic for me is the welcoming, I suppose, of a publication on an evaluation of a Housing First for Youth project, specifically because as a manager of Housing First, I'm often asked the question, what is the difference between Housing First for Youth? Why can't we just take all of the young people and put them into the Housing First project? So in answering that question, having an evaluation to point people towards is going to be very beneficial to me. I suppose in terms of an Irish context and what we're doing around our evaluation, so our Housing First for Youth project in Waterford started in 2015. And we have, the last couple of years, started a pilot evaluation where we're looking at, it's an outcomes evaluation report. So we have, to date, we have been looking at a group of approximately 26 people have been engaged in the process. And we're hoping that we're going to be rolling it out across all youth services within Focus Ireland so that we are able to kind of track the data outcomes for young people who are accessing all of our service and that we get some kind of robust data over a period of time. But from my experience on the front lines, the challenges to kind of researching sometimes can be, and especially in relation to outcomes, can be quite interesting to look at. In terms of research. So why are we researching? How are we researching? One of the things that happened that we saw in our research at the beginning is that from a quantitative perspective when we did the survey, is that we had the opposite reaction to what Kate has been speaking about around seeing positive impacts of Housing First. So our first round, we actually identified people were having a disimprovement in areas like substance misuse, in areas like mental health, or say links with the Gardaí, which didn't really fit with what our experience anecdotally of delivering the service would be in terms of people's lives. So it was kind of interesting to look at that. And when we looked into that a little bit further, it transpired that the young people, when we delivered the baseline survey, didn't know us well enough to answer honestly. So they didn't answer, they answered very, very positively for their baseline. And then 6 months later, when we had built those trusting relationships, they actually answered honestly. So you could kind of say that our baseline for the pilot was actually the second interaction or the second survey with them. And I think that was really interesting for me from a services perspective, and something that we should keep in mind when we're looking at evaluation reports and researching services like Housing First for Youth. And from my point of view as well, as from a service provision perspective, it can be really challenging to engage around research. So what do we want to know when we're doing research? How are we going to use the research? So when I looked at and I read the evaluation report for the Housing First for Youth with the Rock Trust, I thought that they approached that really, really nicely. And the methodology they used, having the variety of methods in their research, I thought gave a really holistic picture to the project itself. Looking at including the staff, the young people, but also the external stakeholders. I thought that was really interesting to include them. And also, given what I said about the surveys and the baseline, looking at a variety of methods of collecting the information. So sometimes you can miss something in a survey that you might get through an interview. So I thought that was really, really good. I also thought that the evaluation report really demonstrated the need and the differing needs of young people. So young people who are coming from the care system, but also young people who are coming from homelessness are all very much individual and all have very, very different needs, some of them very, very complex. But I thought that what was demonstrated really well in the evaluation report was the effective application of the principles of Housing First for Youth. They're very specific 5 core principles, and they were applied really well. And in applying those, they actually did meet the needs of these young people who had experienced many traumas and had complexities. One thing that I thought was really interesting, or I really think to consider in relation to the evaluation report, was looking at cost effectiveness. And I think that can be a really tricky thing and a challenging thing to look at when you're evaluating a service, especially a service like this, where you're looking at meeting the needs of young, vulnerable people in our society. And what I think there's definite benefits to looking at it in terms of and comparing it to things like emergency accommodations. You can also look at maybe, I know that in Housing First evaluations that they have compared like hospital, what an overnight hospital visit would stay, or a stint in prison, or what that might cost. But what is really difficult to factor into that cost effectiveness and therefore to evaluate is, how do you monetize the human experience of trauma, and how do you monetize the experience of being homeless? And I think not just for the people that it impacts, but also for us, that intergenerational piece. So the impact of that trauma, how do you monetize what the cost of that would be to that young person's child, etc., etc. So that's always something that's interesting to think about when we're looking at evaluation and including cost effectiveness. And especially, and I think it really hit home to us here in Ireland, when we're looking at comparing the differing types of services that are out there for people who are rough sleeping or young people who are homeless, how this model, this having front door accommodation, the housing first for the youth, how effective that is in times of, for example, global pandemics, when you need a front door, when you need somewhere to isolate, and where we scrambled with other services to try and create that space and that safe space for the Housing First for Youth that was there. So we were almost a step ahead in providing a service at a very, very challenging time. So I think that just highlights something really, really good about the type of service that Housing First for Youth is. I was really struck around the similarities as well. I have to say, I know that we've been working quite closely, and there's always that that mirroring between the Irish and the Scots, I think. But I was reading the evaluation report, and I think if you had sent it to me and auto-replaced Scotland with Waterford or Ireland, I would have read the report withstanding a couple of differences and would have accepted it as a report on our project, because it's really, really, really similar. And I think key to that is what I noticed, like the key to that, the approach that we're using to building the relationships with the young people, to engaging with the young people, to the culture that we have around the service and the application of the principles of the service, and our values in terms of how we actually treat the young people that we're working with in making sure that we are delivering on those principles. And I think that's really, really key as well to the service, is the delivery of the principles is not just tokenistic, but really, really, really real and lived and actual, and that all forms part of the value base that I think is mirrored in both projects. Like, just to give you an example, in our service, one of our frontline workers was talking to me one day about some frustrations she was having around working with the young person who was going through a difficult patch and engaging in some antisocial behavior, and the tenancy was at risk. And our traditional way of engaging with young people in that way would be to go in and say, this is what we need to do, to list things out, to ask. Whereas when you're using a Housing First for Youth approach, you're just going in and you're saying, how can I help? And the impact of that. And I think when I read, there was a Housing First for Youth worker quoted in the evaluation, and they said, we won't go in and say, don't punch the door. We say, you've punched the door, are you okay? Which is a different way of looking at it. And that's really similar to me, and I really recognize it. And it's of massive value, I think, to the success of the project and the way that we treat the young people that we work with. So I suppose another thing that we'd recognise is the need for system changes. For projects like this to work, to scale up, we do need wider systems change. And I think as an organisation, I know that Kate had mentioned Away Home Scotland and Away Home Europe. I know as coalitions in Ireland, the Irish Coalition to End Youth Homelessness was set up. Also, all of these things as a way of addressing wider systems change. And I think things like this evaluation report can really, really be beneficial to those groups who are trying to go out there all together and make a systems change, that there's something really tangible that they can bring to the table from a European perspective. So we really, really welcome that. And Samara, I feel like you somehow got through my brain and saw my notes for today's conversation, because what I really, really loved about the evaluation report was the introduction of this term, stickability, because it's so important, and what a gorgeous way of describing it, but it's so important to the work that we do with the young people. And we would have described it in lots of different ways to say, we're going to stay with you to the end. It's not time limited, all that, but the stickability is just a lovely way of describing it and very young person friendly. And we would definitely always endeavour to have that sense of stickability. And in the adult service, they call it zero discharge to homelessness, but I love that it's a stickability. Also, I think when we started the project, we were targeting young people who were aged between 18 and 26 was our target group in Ireland. And we didn't really consider the fact that these young people potentially would be young parents. We just never thought about it. And obviously once we started the project, this happened. And we're now at a stage where 50% of the young people that we work with are actually young families. And I suppose that's interesting to think about how we engage with them. And I know from the evaluation report around the social integration principle that they're looking at parenting groups and mums groups, and that's really, really integral part of the integration and really, really interesting to look at and something we should consider in terms of the project. But I also love the inclusivity of that in a Housing First for Youth project, is that while we're targeting young people, it's not a specific type of young person. They don't have to fit the specific type of category, that if they have a family, they can't be part of the service anymore. If they have a boyfriend, they can't be part of, or a girlfriend, that they can't be part of the service anymore. That actually the service, we design the service every single day to meet the need of the young person, as opposed to seeking out the young people who will work with our service. And I love that about Housing First for Youth. And I like that that's demonstrated in the evaluation report, and that it's mirrored between the two areas. Looking at the areas of consideration that came out as part of the report, again, it's so strongly mirrored in terms of our experience here in Ireland. So peer involvement, for example, I think our project in Ireland is really, really great at peer involvement on an individual basis. All our young people are actively engaged in their own care plans. They're actively engaged in their own lives. We're really, really conscious and cognizant of their opinions and being part of, and the leaders and sitting in the driving seat of their lives. But when it comes to delivery and design of the programme, we haven't been great at that. And that's definitely something that we could improve on. So that's a similar area of consideration for us as well. Again, I spoke about this earlier, but the wider systems definitely is something that we need to look at. And I know that we're kind of the difference, we're flipping it. So we started our Housing First for Youth project for young people who are experiencing homelessness, not necessarily from care. And now we're expanding it, where we're targeting young people who are exiting the care system as a prevention measure. So it's really, really important when you're looking at that group to look at the wider systems and to look at engaging the government in relation to the aftercare supports available, and also in relation to the rights of people. I know Kate was talking about housing being a right in Scotland. It's not a right in Ireland yet, and I know that we're working on that, and that's a wider system thing, but that youth can form part of that. And equally, the importance of having things like youth strategies, etc. And the coalition, again, is something that is important to putting that forward. And the third area of consideration was around education, training and employment, and trying to encourage or to look at that. And I know that Kate was talking about there was some really positive, surprising, I think, maybe faster than they anticipated, positive effects about engaging with education. And we had a similar experience here, and Focus Ireland did research in our Limerick youth housing project a number of years ago, and one of their key findings was around the encouragement or how to access education and training for this group of young people. In Waterford, we're really, really fortunate that Focus Ireland has an education service, which interestingly enough is called PEAT, which is Preparation for Education, Training and Employment. And we had the ability to change that service for the education workers to approach the young people and to approach the area of education in the same way, with the same values and the same culture that we did for Housing First, which even included some home visits and visiting support, as well as classroom-based interactions. And that has been really, really positive. That has really increased the engagement in education. And even just this year, we have 15 young people from our Housing First for Youth project engaged in education, in further education, and 4 of them in employment, which is really, really testament to that, having that service there that could concentrate solely on education, especially given that we've had a pandemic and been locked down. It's great that we had the specific service there that could concentrate and keep going on that. So what are the differences? Because there has to be something, right? It can't be the same. It can't be the same project. One of the major differences for us was the housing option. And I know, Samara, you were talking about that in response to Kate around the partnership with the Amond Housing Association and the partnership between the service and the AHB. I'm really, really interested in that, as I'm sure a lot of people are, and I can't wait to hear a little bit or to talk more about how we do that. Initially in Ireland, when we started, we sought to do that, but it was really, really challenging and we couldn't get that across the line. Fortunately, Focus Ireland is an AHB in its own right, so we were able to procure housing specifically for the project, and that's what we ended up doing. But I think when we're looking at scaling up projects like this, it would be really, really interesting to look at all the different housing options that would be available. And again, this evaluation could be really helpful to us in doing that. The other way that we slightly differ is that we have a very formal care and case management model of support that we use with our young people in conjunction with other services in the area. And it's mandated and supported fully by our local authority and our health organisation, our statutory health organisation. And that's been really, really helpful, because where I know that the Scottish Evaluation was speaking about it, the stakeholders, and they were talking about how well the workers brought other people or aligned other services to this way of thinking. Having the statutory organisations involved in the care and case management and brought into the care and case management has been really helpful for us in changing the kind of overall view of the Housing First for Youth. And as I mentioned earlier, then the other difference was the way that we've gone about the expansion and scaling up. So we flipped it. So we're now targeting the aftercare, but we're also trying to scale up in terms of expanding it into different local authorities. And we are looking at also reconfiguring services, which I think is a really interesting thing to look at. And it's a way that we've been able to introduce Housing First for Youth into the aftercare system, is that we did make a decision that we were going to replace the traditional service that we had, that was outreach, support and settlement and short-term accommodation. And we were replacing that service with Housing First for Youth. And that can be sometimes a challenge for organisations, are we doing the right thing? It's also a very new service. And this has been the way that we've been working for so long. But I think that seeing the results from an evaluation report like that really strengthens the argument to allow us to do that, and also gives us a really good base in terms of, from a leadership perspective, about why we might look at doing that and why we might reconfigure. And that sometimes is a little bit easier than asking for additional money or extra funding. Sometimes it's about using what you have and reconfiguring to the service that works. So the evaluation report will be really good to look at that. So I think overarching view is that we have so much, even as similar as we are, from our perspective, we have so much to learn from each other. And I think I'm really interested to hear about Melanie, and I've heard a little bit about Canada before as well, and also about other areas that are delivering it. But it might be really interesting if we had some kind of platform for us to share experiences or build our capacities, or to look at ways that people did. Be a really, really interesting thing to do into the future. what I'd like to finish up by saying is a huge congratulations to everybody at Rock Trust and the European Housing First Hub for getting this, not just the project up the line, but the actual research out and published. To Imogen, Sarah and Deborah for being involved. To the frontline services as well. Sometimes when you are reading an evaluation report like this, it's fantastic and it's a very, very positive report, and it reads very positively. But I know from experience that getting to that point is very challenging, and it's not as easy to, it takes time, it takes perseverance. And so a huge congratulations to frontline staff who are constantly battling to prove why they're doing this service. And sometimes it can be really challenging. So well done to them. And also well done for being involved in the research, for being able to be doing this and making the time to do that, because that's not easy when you're dealing with frontline work or crisis with young people, to take that time out. So huge congratulations to them. And of course to the young people who are involved, because I think for the young people to do surveys or be engaged in research can be really, really challenging, because it's their lives, it's their experience, and they're putting it out there for the world to see, and it's a really brave thing to do. And whether or not they will say this, maybe Kate, you might pass it on, but thanks to all the young people in Scotland, from all the young people in Ireland who potentially will benefit from their sharing of their experiences. So on that note, I shall leave you.
Thank you, Lisa. No, I think that was really helpful too. I mean, I know the two projects as well, and I think it's really important to be able to echo the similarities, but also spot the differences and where we can learn from each other. And that's exactly where we're all headed, I hope. So thank you. And I have some extra comments and questions that we'll come back to at the end. And that's the other thing. I just wanted to point out that you can type your questions in as you get them into this question and answer section on your screen, and we'll have the panelists take a look at them over the course of the next presentation, but then I will make sure that they get answered before the end of the session. So don't worry, they will get answered. But without more further ado, I want to introduce Melanie Redmond, who is going to speak to us from Canada today. And Melanie's the co-founder and CEO of Away Home Canada, which is an inspiration to lots of us here in Europe, where we've been working to get an Away Home Europe going. We have Away Home in Scotland, as well as the Coalition to End Homelessness, Youth Homelessness in Ireland. So Melanie's work is inspiring to us all, and in particular how she engages so many of the absolutely relevant partners to come together and build things collaboratively. And so I'm really happy to welcome her to this webinar which we've helped build together, and I'll hand it back over to her.
Thank you for having me. One of the things that I found the most valuable since I came to work on the issue of youth homelessness is international collaboration, this opportunity to share, to learn, to support, and to grow together in this movement for change. So this is really wonderful. I want to start with all of the shout outs that Lisa gave at the end to all of the different to this work. I'm going to start with that and just put it right on the table. So thank you to from the youth, to the service providers, to the peer researchers, to the researchers, everybody involved in making this happen. Also to the Government of Canada for funding our work. Thank you. So Away Home is a national coalition reimagining solutions on the issue of youth homelessness. And we really focus in on public policy, practice on the ground in communities, and systems planning, which is a really important component of our work. We take a collective impact approach. This is important for so many reasons, and it's the most difficult work, but it's the work that needs to be done if we're going to impact on the systems that drive young people into homelessness, but must be part of the solutions. And in that collective impact approach, one of the groups that we've collaborated the most closely with are researchers, which is kind of unique, I think, in the relationships that we've built. So we partnered back in 2016 to craft a vision for the Government of Canada to consider funding with the Canadian Observatory on Homelessness at York University. And many of you would know Dr. Stephen Gates and his work, particularly on the issue of prevention and of homelessness writ large, but his passion for youth homelessness and prevention and this Housing First for Youth work. So we launched the Making the Shift Youth Homelessness Demonstration Lab in 2017 with funding from the Government of Canada, which allows us to do demonstration projects, and you may not be familiar with that language, but demonstration projects in 2 provinces, in 12 sites in 10 cities across Alberta and Ontario on models of prevention and Housing First for Youth. And I'm going to talk today just about the Housing First for Youth work, but we've published a lot of information about the demonstration projects writ large that you can find on the Homeless Hub website or the Away Home website. So the Canadian context on Housing First. Back in around 2014, Housing First was being rolled out as policy and investment from the federal government across Canada, which is a wonderful thing. But the challenge with that is that youth homelessness service providers were very concerned that Housing First, the adult model, wasn't going to be successful with young people, but that seemed to be where the investment was. And so they were very nervous about current services being defunded as well. And many of you will know that we ran the largest study of Housing First in the world, I think, to date. I don't think the French study was as big as At Home Chez Soi, but I could be wrong. Called At Home Chez Soi. And one of the findings was the recommendation that for the young people, the under 25s that were participating in At Home Chez Soi study, that we might want to consider modifications of Housing First to meet the developmental needs of young people. And so that was really key. You'll recognize this slide, and I think Kate mentioned this before. One of the tendencies, in the last few decades is to take homelessness services for adults and just create homelessness junior, which again isn't necessarily appropriate for the developmental needs of young people. And so in Canada, we worked with service providers, youth with lived experience, policymakers, et cetera, led by the Canadian Observatory on Homelessness to adapt Housing First for the needs of young people. And so back in, I think, 2014, Steve Gates and team launched the Housing First for Youth framework. Then we collaborated together on Housing First for Youth framework to do an international consultation that included many of the folks on the phone, et cetera, or not on the phone, on the webinar, to strengthen the model. So how can we go from a framework to an actual program model? And so we came out the gates with a program model guide around the same time that we launched the demonstration projects. So in terms of the demonstration projects, the initial from the 2017 are 3, one in Ottawa, one in Toronto, and one in Hamilton, and I'm gonna talk about those. In Ottawa, led by our partner Youth Services Bureau in partnership with other organizations on the ground, supporting young people exiting public systems. And so I know that Kate and Lisa both referred to adaptations of Housing First for youth for specific subpopulations. And I think that's really important in our collective body of work for us to keep testing it and see what needs to be different, what needs to be modified, enhanced for the needs of specific subpopulations. In Toronto, led by our partner at Wood Green, we have Housing First for Youth for care leavers is the language that they use in many of the European contexts. And so this is a very interesting project. I think, one of the things that in the Canadian context, the issue of exits from care and young people being transitioned into homelessness has really been front and center in the last years. And so we're hoping that what we learned from this project, from this demonstration project, can really help inform that national conversation. In Hamilton, we are partnered with the Hamilton Regional Indian Center to adapt Housing First for Youth for Indigenous youth. And this one is, all the work is really close to my heart, but this one, I've learned so much about truth and reconciliation in partnership with Hamilton Regional Indian Center, their staff, and the young people in the programs that's really benefiting all of our work. And so it's pretty special. It's called Indayang, And it really highlights the importance of cultural reconnection given the history of colonization and the damage that's done across generations from that colonization. And that's involved some really fantastic Indigenous innovation. One of the things that we love is they made like a physical case management tool that melds the core principles of Housing First for Youth with really important Indigenous teaching and ways of knowing. And they work with youth with this physical tool with case management to set goals and to check in on those goals. And so that's some of the things that are emerging we'll be making widely available in partnership with our Indigenous partners. We've got a video about the case management tool right now that you can access, but we're going to be building out the resources that go along with it. Oh, there's another image there. Another thing that's happened, obviously, old Pandy, as I like to call the pandemic, it's obviously created a lot of challenges, both for the research side of our Housing First for Youth demonstration projects, but also obviously in the service delivery and how the young people are experiencing the world, what they're able to access, etc. But I've been very excited about some of the adaptations that we've made across the board. And a lot of those wonderful adaptations and innovations have been led by our peer researchers working with young people, which is really cool. So demonstration projects means a healthy dose of research and evaluation. Just to note, we've got about 120 young people across the 3 sites, but we're really excited to announce that we have 4 new sites coming online from different funding sources, but we're funding the research and evaluation component of that and aligning it across those new sites. So we're going to have a much larger sample. Research qualitative and quantitative methods. By the way, I'm not a researcher, so I'm just saying these words and I kind of know what they mean. I do know what peer researchers are though, and I'm really excited that we use peer researchers across the Housing First for Youth sites, and they add so much amazing value. Then it's a randomized control trial, which can be quite controversial, but we've done a lot of work with our community partners, with the youth, both in the participating in the program, but also the control group that are getting services as usual, to make sure that everybody is comfortable and understands what it is and make sure that everything is in place to make it as ethical as possible. We're also doing developmental evaluation and outcomes evaluation alongside. So pretty hefty. Something I want to mention though is Dr. Samson Barris, who is the father of the Pathways model of Housing First for adults, has been our clinical director from the beginning of the project. And when we first decided to go down this path, Dr. Gates and I were really concerned that Sam would be mad at us, and so we were kind of avoiding him at conferences and such. But then we ran into him and he said, hey, I want to talk to you about this Housing First for Youth stuff. And then we're like, uh-oh, and good thing we were in a bar and had a pint. But he said, this is exactly what we need to be doing. This is where we need to go with young people. And so that was very validating, and his expertise has been a huge guiding factor for us. We have a huge focus on outcomes with all of this work. Why? The Canadian research on what happens to young people when they exit homelessness is not good. It shows that they're not living well, they're not re-engaging with education and employment, they're socially excluded and living in poverty. And so most service delivery isn't driven by the outcomes that you want to see, and therefore the service provision, unfortunately, doesn't get at those outcomes. Now, of course, there are a lot of exceptions to that, but the Canadian research points us that we need to really focus on what are the outcomes that we're trying to achieve, and then model the services, the activities, the case management, everything toward achieving those outcomes with young people. And critical, of course, is having young people help define what those outcomes are. So in our demonstration projects, we're looking at program outcomes across these domains. And we, again, from the Housing First for Youth model, the original model, to the research design, everything, we've worked with young people with lived experience along the entire way. One of the things that I love about the Housing First for Youth core principles is that we're working with the Away Home Ottawa group, and they had a huge contingent group of people with young people with lived experience really driving the Ottawa away home work. And when they looked at the Housing First for Youth core principles, they said, you know what? These principles need to drive our entire youth homelessness strategy for Ottawa. And that was really a wonderful awakening for us, because just thinking that those core principles aren't just part of a service model, but that they should drive the whole system's response to youth homelessness is really powerful. So take that into consideration. So what's coming down the line for us? We're pretty busy. The pandemic hasn't slowed us down much, I'll tell you that. So training, tools, and resources. One of the things that the government investment allows us to do is to create tools and resources, trainings, et cetera, to support other communities and our partners around the world to adapt, to take any of this that you'll find useful for your context. So we have, of course, the This is Housing First for Youth program model guide. Sam and team with the Housing First Europe have adapted it for European context. Fantastic work. It's available in French and English, both the European adaptation and the Canadian. Housing First for Youth online training modules are now up on the Homelessness Learning Hub and are readily available and free to access. And Samara can make sure that everybody has the links to these things. Housing First for Youth Fidelity Test. We have not only, we work with the fidelity test developed by Samson Barris and Heidi Walter and others, but we have a different approach to fidelity testing where we don't just go in and do the fidelity test and then leave a report and walk away. We leave the report and then we make a strategy for how to implement that report. And then we check back in and support the service providers in community of practice to be able to make achievements against the recommendations in that report. So very hands-on. Housing First for Youth operations manual coming soon. I think it's in Dr. Gates's inbox to be reviewed. So we'll try and get him freed up so he can do that. The Family and Natural Supports online training modules are coming soon as well. Training in family and natural supports is really critical, as both Lisa and Kate have highlighted. The work around relationships is critical. And so we're building that training so that people can do that work better, because it's really important work in Housing First for Youth. And the roadmap for the prevention of youth homelessness is kind of our anchor that grounds all of this work. So yeah, so hopefully those are resources that can help you in your community. I will mention one last thing, which is in response to assessment tools that our service providers felt were not appropriate for young people, and also were not great at taking into consideration the knowledge of the workers in assessment, asked us and Wally Check from the Canadian Alliance to End Homelessness to work to develop a youth tool, a youth assessment tool. And so we've been on a journey for a number of years now, and we finally have the Youth Assessment and Prioritization Tool, YAP, that's been developed and it's being tested with our Housing First for Youth demonstration sites. And Dr. Tim Aubrey, who may or may not be on this call, but it was a very important component of the At Home Chez Soi project. He and his team at the University of Ottawa engaged in a validation process, made tons of recommendations for how to strengthen the tool, and we're now implementing those recommendations. And so soon we'll be rolling this out writ large for communities to access. And unlike some, our work is free and open source. So we'll welcome everyone to reach out to us about the youth assessment and prioritization tool. And I'm throwing Heidi from my team under the bus here and giving you her contact information in case you want more information. But yeah, but again, just to go back to the Rock Trust and to Focus Ireland work. It's been such an inspiration to see all this work unfold on the ground. And it's been quite a journey that we've all been on together since Budapest, as Lisa referenced, where Firenze Youth enabled a whole week of us to be together with other practitioners from across Europe for a Housing First for Youth training session. So hopefully we can inspire other communities and countries around the world to take up this important work. Oh, one last thought. One of the things that's really been fantastic emerging from our demonstration project so far in terms of outcomes. So keep in mind, we have almost 2 years of data now, and so we're going to be putting out a lot of research findings in the coming months, so stay tuned. But one of the things that's really standing out for us are that the education outcomes so far are incredibly strong. And why is that? I just want to point back to something that I believe that Lisa said. Kate, I'm sorry if you also said it, maybe. But that one of the things that's unique about Housing First for Youth is no time limits. And so when you give young people time to, and they don't think they have a cliff 1 year out that they're going to drop off of, then they have time to start thinking about those long-term goals and getting at things like education and employment. And so I really think that that's one of the unique features of Housing First for Youth that we might want to consider across all of our services we deliver. Okay, thank you.
Thank you, Melanie. I think it's also really exciting for us to be able to check back in on what you guys are doing, because it's always an inspiration to us, and you're always sort of at least a couple of steps ahead in terms of the research and the tools and so on. So it's great that we get to work with those tools and adapt them and help to build them as well. I mean, I wanted to say a few words in sort of my comments, and then we'll go to the questions. But I think what's important in particular from these 3 examples is how I think a lot of people might be feeling like, well, I don't know how to get started. It feels like you guys have done so much. It feels like you're such big players and big actors. And it's true, you guys are all very important in what we're doing, but it's all started really quite small. Like, I think you can accept, you need to know that everybody started from a position where you weren't doing Housing First for Youth. You had to convince your own organization to make that change in how, in sort of philosophy as well as operational approach. Convince your colleagues to do that, and then start from that basis. And so I think that because it's such a model that you can start from this very small scale grassroots level, but it can trigger such important changes. I think that's what can be inspiring for people, is that it's not something you have to wait for it to be decided up above you and then do it. And I think that hopefully you can see, this is not a closed circle that we're in. We're very keen to involve anybody who wants to do Housing First for Youth and wants support or mentoring. That's sort of why we organize these things, so that you can reach out to us and we can put you in contact with the people you might need to help get your project going or check in or build your evaluation. And the other thing is that this idea around education outcomes, I think as we get more and more data from the projects, I think that it's something that's really very important, particularly for the young people, but also as we try and go back up the flow and look at sort of prevention as well as responding to the crisis. I think that the role of education, both in a crisis moment and in Housing First for Youth, but also in a prevention approach. I think those are things that are really important. And one of the things we've always talked about as one of the main differences between Housing First for Youth and Housing First is that the partners that you engage with, the actors that are part of your coalition to make sure that you can create and provide the services that young people need. And education is one of those that we don't see in Housing First for Adults because it's not a necessary actor or as an important actor. And I think that that's something that I would like to see maybe a bit more research on, or at least us look at how do we help people to engage as best as they can with the education sector or the alternate education sector, because I think there's a lot of potential there. So those are just my kind of like closing remarks, but I wanted to say thank you to everybody. And now maybe we can kind of go to the questions. There's some questions in the Q&A. Most of them are from Australia. And so the first one is about the staff ratio. So I don't know, Kate, do you want to respond to that one about the staffing ratio in your project?
Sure. We went with what had been used in the past and what the evidence said worked, which meant each staff member's caseloads were limited to 7. So between 5 and 7 young people working with a staff member. And we had to make sure that each young person was connected to 2 staff members so that during periods of leave, they weren't meeting with a stranger. So everyone was connected to 2, but they had a key worker who was their main worker throughout the project. And we've kept it to a limit of 7, being a maximum limit. Unlike our visit and support and other housing services, where it'll sit around 15. So yeah, quite. And it's so you can react very quickly. You need to be able to react quickly. And some weeks it will be, 20 hours of support, and some weeks it will be no engagement, and you're trying to find the young person wherever they might be.
And there's just, maybe you can tackle the second one too. There's a question about recruitment of staff. I don't know if you want to say something about that as well.
For us, we recruited staff members, and we had some internal staff actually. We had some staff who we knew had the right values and skills that would work very well on the project, who'd been previously delivering other homeless services, either outreach or housing support or drop-in services. But it definitely takes a certain amount of skill. So we were looking for people who had quite a lot of experience of delivering several different projects. They needed to be able to respond to young people, whether they were being demanding or whether they were not turning up and not being available. So it takes a certain type of person. But actually recruitment was fine because people at that point were starting to learn about Housing First. There was already one project in Scotland, people had heard of that, but we managed to get some quite skilled people. And I don't know about you, Lisa, but we tend to recruit people who've either got lots of experience in homelessness or who've got lots of experience in youth work. And we teach the skills that where there might be a weakness. In this case, we went mainly with experience of homelessness and did the youth work training. Because actually the young people we're talking about have been in the system for a long time. So that felt like us to be where the skills needed to be.
I think I'd agree, if I could come in there, just in terms of the recruitment, the most important element of the recruitment is the value base of the people who are coming in, and also then engagement skills, so their ability to build relationships and engage with young people is really, really key. And you'll see throughout the evaluation, they speak of relationships. I know anytime that we've done interviews or spoken to staff and I've asked, what's the one thing that you tell us to keep, or if you were talking, say we met with a group from France who are setting up a project, and I said to the young people, what would you tell them to do if you had to ask them one thing, and the thing that they said was get someone like Kieran, get someone like Claire. So it's like the relationship really, really is key. So you have to get people who are willing to engage really, really positively in some very challenging circumstances, sometimes with young people who all they want to do is tell you that they don't want to engage, because trust is a massive issue and attachment can be an issue. So the recruitment of the staff is actually key to the project, I would say.
And I think what's really interesting is some people talk about the relationship as being parent-like, and some people talk about it as being friends and informal. And I think that captures it. And the reason people think that is because it's parent-like, not in the putting in rules and boundaries and being the authority figure, but actually in the unconditional support part of it. And it's friend-like in that it is quite informal, and you're walking alongside somebody, you're not putting rules in for them. You're treating them as you would do a friend. If a friend punched a wall, you'd ask them if they were okay. You wouldn't tell them not to do it, and that's that. Yeah.
I remember Kate. I remember when Ali, I think, from your team, was putting together the job description for the Housing First for Youth worker, case manager. And I remember in the description, it was so powerful. It said, we're looking for someone basically who will do whatever it takes. And I've often shared that story with our partners in Canada of how that really is what we're looking for.
I see there's a question about housing, access to housing. So I think that's a question that everybody has. So I don't know, I'm quite interested, Kate. I think you worked closely with the Almond Housing Association, and maybe you could just say a little bit about your relationship with them, how you recruited them, and maybe give any tips that you might have to others who are looking to recruit housing partners.
Yeah, and actually our relationship with our housing partner was not easy in the slightest. There was a lot of learning and mistakes made, but it's put us in a good position now to go and build more relationships with other providers, but also to help others build those relationships. So for us, we worked with Amand Housing Association, and we were lucky enough that they not only contributed money towards delivering the project, they also contributed with some of their own resources, in that they gave us a dedicated person to liaise with, which was great. And their team came along on the training with us, and so they really understood the model we were trying to use and what we were trying to pilot. And I think to the point where actually when some of the young people were, whether on paper or whether they actually met them, they knew it would be young people that wouldn't have got housing otherwise. And they have embraced this hugely. And they were really supportive throughout the whole project, and not just in delivering it, but in getting others on board. But part of that was about being quite honest and about acknowledging that we have to work together regularly, and that there'll be some things we might both be uncomfortable with or find difficult. It might be changes we both have to make. But yeah, it's been amazing. And actually it's what you talked about in, I think it was Ottawa, Melanie, they're now kind of saying we want to use that kind of method across all of our housing. And we want to, make sure people have got the support and so just changing the way they work with young people across their stock, which is amazing. But they provided housing and gave choice and enabled us to move young people between houses when they didn't want to stay where they were. So actually the relationship with them was vital. And there was points where we perhaps shared too much information, and it was getting that right. The landlord and the support need different information. They should be involved in different ways. And actually the team working together on the front line was the best thing that could have happened.
Great. Melanie, this is a question also about housing and from Australia, where, lots of people's housing markets and access to social or social housing is very limited. And so there's a question, if there's not enough access to public housing, are there other routes, i.e. through the private sector or through philanthropy? Are there other examples of that? I don't know. Melanie, do you want to take that one first? I don't know.
Sure, yeah. Well, in the Canadian market, unfortunately, it's mostly private because our the waiting list for public housing, for social housing, is incredibly long. We have about a 20-year backlog because the government stopped investing in building affordable housing. Thankfully, we now have a national housing strategy, but we're going to be in catch-up mode for a long time. One of the things I think with the private market is the relationship with landlords is critical. And one of the things that we found that really is the magic sauce is reminding potential landlords that, your other tenants, they come in with no services, no supports, but this young person comes with supports. So if there's a problem, we're here to address the problem. So that's not on you. And so that's really attractive to the private sector. So we found that to be pretty successful. And we found a number of landlords that then become champions because they're excited to be helping a young person to stabilize their housing and move on and achieve their life goals. So
that's great. Okay, that's a good answer. But the question that we all face. I just see that there's a question to Lisa into the relation to reconfiguring of former services. And were they supported housing, supported accommodation? And if so, had these been big, larger accommodation services, and how well has it worked?
Okay. So first of all, it was a transitional housing program specifically targeted for young people who are leaving care. So it was a 12-month program for young people leaving care. And alongside of that, it was a support and settlement program for young people who've left care who are living in different types of accommodation. And again, it was a 12-month period, so a time limited. Can I say, I can't say yet because we just started this year. So we started the reconfiguration of the service. Obviously, when you're delivering a service and you're reconfiguring, there is a period of time where you're transitioning the service because you have to consider the young people that are currently in situ in the way that the service was and then where you're going. So I can't yet say specifically because we're literally just at the point where we've transitioned and now we're just doing Housing First for Youth where we were transitioning before. But given the way that our Housing First for Youth project has worked, for young people who have experienced homelessness. I have no reason to think that this won't happen for this cohort of young people, that the same outcomes won't happen. I'm really interested actually to hear, and I might chat to Melanie later about how the model is being used differently in Toronto, specifically for care leavers. So I can't yet say, but I'm hopeful.
And there's just I think a fairly short question to both Melanie and Kate. Lisa mentioned that young parents are a group that you are working with in Housing First for Youth. And actually in Kate, I know the answer that in the evaluation, you do talk that there are some young parents amongst the group. So the question was just, are young parents a significant group in the Scottish and Canadian work as well? Kate, do you want to take it first and then Melanie?
So in Scotland, they haven't been in either the Housing First for Youth or the Housing First project, a massive part of the groups, and definitely not parents who have their children with them full time. So we do have some mums or dads who are now getting access to children, but we don't have people that are being housed with their children. And that's probably because other types of accommodation are more accessible to them and sometimes work for them. So the group we were working with is the most complex group, and those young people tended to be no longer in touch with their young people, their children, or at least no longer residential custodial.
Okay. And Melanie, can you speak to that from Canada?
Yeah, it's very similar. I mean, what's bubbling up from our practice and research teams are that a lot of young parents have had their children taken into care. And so the parent is in the Housing First for Youth program. And so part of the family and natural supports work is stabilizing the young person so that they can have their children back. One of the structural barriers that we've encountered, though, in thinking about provision of housing and income supports, is that young people are eligible and can afford 1-bedroom apartments, but the requirement to get your children back or your child back is that they have their own bedroom. And so there are all these like weird structural barriers that we're having to address head on, and hopefully can influence policy moving forward to remove those barriers.
Yeah. And there's just one last question, and I think even I can answer this one. It's that asking if there's specific training for Housing First for Youth workers that's been developed as part of the Housing First Europe Hub. And yes, yes, there is. So we've based our training on our own experience, and particularly on this experience of the 3 speakers here today. And so we've been running it fairly sporadically, but at people's request. So that's definitely something, if you're interested in the training. Obviously, right now we're running it online. At the moment, Lisa and I have been training Housing First workers in France, because in France there's 2 big pilot projects being started in Lille and Toulouse. So yeah, so we do training, and we really want, and this is maybe a good moment to sort of launch this idea, we want to sort of establish this, just as the Housing First Europe Hub is a network of people working on Housing First, that we really feel like this is also the space for those people who are working on Housing First for Youth, who want to exchange, who want a platform for that, to share research and so on. So if you are interested in that, please just drop me an email and let us know, and we will continue to make these kinds of opportunities while we all can't travel. And in terms of the training, we're really hoping to gather all of the existing resources, particularly the fantastic online tools that Melanie and Stephen Gates are developing in Canada, and make sure that they're available through our website, that you can link from our website to theirs to get to them right away. I don't know if anyone has any closing remarks, or you're all good. I wanted just to say a huge thank you to all 3 of you for taking the time, for always taking the time to make this such a positive collaborative space, and for putting in that effort to listen to the young people, to make sure that what we're building is something that responds to their needs and their desires, and that having this research proves that we're all working in the right direction. And I think that's something very valuable for all of us. Thank you to Claire, who we can't see, but who's there, who's done all the technical magic to make this happen. Thank you to the participants for staying and for your great questions and for joining us today. We really appreciate that. And like I said, everything will be available on our website. The recording should be up in a few days' time, and all of the links. So don't hesitate to get in touch with more questions and comments. So thank you all.